Second class of drugs of anti-anginal drugs are beta blockers. So we know that there are two types of beta blocker: the selective beta 1 blocker and the non-selective blocker. The selective beta 1 blocker include like atenolol, bisoprolol, metoprolol, and the non-selective which acts both on beta 1 and beta 2 like timolol, nadolol, etc. Okay, the mechanism of action of beta blockers. So the beta 1 blockers are basically preferred and angina. Why? Because beta 1 receptors are present on the heart. It will block the beta 1 receptor on the heart, will decrease the heart rate and the force of contraction. It will decreases the cardiac work, and when the cardiac work is decreased, it means the oxygen consumption by the cardiac muscle is decreased. So in a sense, the oxygen demand is decreased and the patient may feel better. They have slow onset of action, okay, and they can be used prophylactically for the exertional angina. Note a point that pindolol worsens the angina because it has sympathomimetic effect. The adverse effect of the beta blockers include bradycardia because of the overextension of its pharmacological action by acting on beta 1 receptors. It may cause heart block because it also acts on the AV node, and it may cause bronchospasm and asthmatics because, as we know that in the respiratory tract we have beta 2 receptors. So when non-selective beta blockers are used, it will cause bronchoconstriction. The beta blocker should not be withdrawn abruptly because by chronic use of beta blockers there is hypersensitization of beta receptors, and when abrupt withdrawal occurs, then arrhythmia occurs. Okay, a very important point that beta blockers are contraindicated in variant angina. This is a very important point and should be explained, as we know that this is a coronary vessel, and coronary vessel has both alpha receptors and alpha 1 and beta 2 receptors. Alpha 1 receptor causes vasoconstriction and beta 2 receptor causes vasodilation. So when the beta 2 receptors are blocked, then there will be increased alpha 1 activity, which will cause vasospasm and may worsen the variant angina.